All right, now it's recording, and then I'm going to share my screen so we can start. All right, everybody can see my screen?
Yes.
Okay, perfect. Hey, so as you know, we're going to talk about the tennis elbow. So everybody seeing the screen about the tennis elbow, right?
Yes.
Okay, perfect. So we're going to talk about like what is the tennis elbow, how it happens, what is the basic anatomy, what to do, how we can fix it, how we can prevent it. All those things we're going to take care of it today. And okay. So to start with the tennis elbow is not necessarily happens while you're playing tennis. It can happen while you're doing any kind of movement required repeated movement of your wrist or your elbow. Okay. So it's very important to understand the basic anatomy of the tennis elbow. So you will understand more when I show you here in this picture. So if you see that here is our elbow, okay? And then the outer side, right here, you'll find some bony prominent on the outer side of the elbow. That's called the lateral epicondyle of the humerus. As you see here, so it's under the muscle, you will see like it's very prominent on the outer side. So when you feel that prominent area, that's your lateral epicondyle. That's a part of your humerus, okay? All those common extensor group of muscles originates from there, okay? So that's the first part, lateral epicondyle. That's a bony prominence located outside the humerus. That's the reason that many times when you have the tennis elbow, if someone comes with the elbow pain, the first thing I check is to see if that area right below that prominent area, if you feel any tenderness. If I see that, okay, that's tenderness, that definitely triggers, that indicates that it could be a tense elbow. If you feel it more inside, because if you look inside, it's called medial epicondyle. We're gonna go that as well. If you have any problem or tenderness there, there are possibility that's the golfer's elbow, also called as a medial epicondylitis. Okay. Now, as you see, the extensor carpi radialis brevis. I know you don't need to know all the basic anatomy or don't need to remember all the name of the muscles or everything. The reason is important is because that's based on those muscles, you know that what movement you don't want to do it or what movement you want to do it. Okay. If you have any question throughout the presentation, please write down the question in the chat and later on I'm gonna answer all those questions. So the most important muscle which affect with the tennis elbow or lateral epicondylitis is this, the extensor carpi radialis brevis. Okay, so you see this muscle right here, it goes like this, and it goes in like, in the hand. So that right around here, this is the tendon that most of the time get affected more. So when we do some gua sha tool, when we do some instrumental assisted soft tissue mobilization, or when you do any kind of manual therapy, we focus more around here, this muscle especially, because this is the muscle which gets affected the most. Okay. All right. But the very common other muscles, the along with the brevis, we also have the extensor carpi radialis longus, which is right around here. Okay. Then we got the external digitorum muscles, and also it's important to understand, like, how where it inserts. So if you look at this muscle goes in the base of the second and third carpal bone. So it goes around here. So the purpose of this muscle is when those muscles get activated, your wrist extends like this. Okay. So that's the reason that, like, that is very important to understand these muscles. Then the other muscles, the digitorum muscle, which is again, like, it comes right around here, and the external carpi ulnaris, which goes more on the middle finger. Okay. So these are the very common muscles that get affected when you have the tennis elbow. All right. Now, the injury type. So what are the stages? Like once you get injured, once you think, okay, yeah, I'm having tennis elbow, or I'm having pain, what is the types of injury you got? Okay, so the tendonitis is basically a small tear in, when I say ECRB, is extensor carpi radialis brevis. That's the short form of that particular muscle. So it's called extensor carpi radialis brevis. So initial, you got small tear. So let's say you did some hammer work, for example, okay, and you did like, some repeated movement, and all of a sudden your muscle, your tendon is not ready to take that load, and you pull that tendon very quickly, very jerky way. So when that happened, you get some small tear in this particular tendon around here. So right around here, you get small tear. Very good. Small tear, no issue, but you start getting some pain because our body's response is the inflammation. Okay. So anytime when you get injury, just like when you have a kitchen knife cut, the healing will happen. The scab will build up. That's a normal process. Just like that in our body, there is an inflammation phase where once you injure that small tear, slowly it's gonna heal. So that's called the tendinitis. That's the initiate first stage of that. And that causes the pain, swelling, and tenderness because that's very common with the inflammation. That's the stages of the inflammation. So that's the reason that when you injure something, immediately you see pain, swelling, tenderness, and everybody knows rise is the first thing to do whenever you see any of those things. Now, second, not necessarily this the type of injury can happen in the same order. It can be different order too. The micro tear and collagen disorganization. So, as I said, like with the repeat injury, it caused more micro tear. So, like you had one small tear in the ECRB first, you ignored it, or you keep on having some kind of like, the movement still, and that can happen multiple tear. Okay, and then your collagen fibers within the tendon may get disorganized. Now, collagen fibers are the main fibers. It's a structure of the protein that you need it to maintain the integrity of that tendon, to maintain the strength of that tendon, because that's how you can get the normal function. Because the after the injury, when you're trying to move your elbow, when you're trying to move your wrist, you feel weak after this particular injury, and that is because your collagen fibers get disorganized around the tendon. Okay. Now it leads to tendinosis. So initially it was tendinitis. Okay, now it became tendinosis. The tendinosis is a chronic condition. Now that acute phase is gone. Now you get to the point where like, you're building up the scars, and like, your tendon gets like a little bit thick, and then like, it doesn't move smoothly. So it degenerates now. Okay. And then this time in this phase, your inflammation might not be there. Like, your inflammation is gone. That phases of that pain, swelling, the pain might be still there, but like in your swelling, redness, those are gone. Okay. But now it got some degenerative changes in your tendon. That's the reason your tendon doesn't move the way it should be. Okay. So in tendinosis, it becomes more abnormal collagen and the other metrics. So all those internal structures, fibers, collagen that normally should work properly, you got all disturbed now. So that becomes more chronic then. That's the reason that it takes longer to get those things in right place, and then it takes longer to heal. The other one is the neovascularization. In what happened, our body heals by itself. Regardless of the injury, our body try to heal itself in the right way, wrong way, doesn't matter. It will heal. Okay. So what body do? It creates extra blood vessel around the injury because they think, okay, we need extra blood vessels to heal faster. But during that process, when they're creating the extra blood vessels to increase the circulation to heal it, that is painful. That can cause extra pain, and that's process of creating the extra blood vessel called neovascularization. Okay, and as I said, like the sequence doesn't matter. Sometimes it depends. Like some people get more vascularization earlier than later, so it depends on the stages. Golfer's elbow. Okay, so tennis elbow, golfer's elbow. So the golfer's elbow is more inner side. If someone has a pain in the inner side, okay, that is most of the time possible is golfer's elbow. Okay, it's also called the medial epicondyle. Okay, again, the bony prominent on the inner side is the medial condyle. Here, the most common muscles that get affected is wrist flexors. Okay, the common muscles are planaris teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris. Don't need to remember the names, okay? But it's right around here. So as you see, like all those front muscles, okay, are here. So flexor carpi radialis, palmaris longus, flexor carpi ulnaris, flexor digitorum superficialis, all those muscles goes in the hand. So this is the front side of the forearm, okay? So now these flexors are in the front side of the forearm. Extensors are in the back side of the forearm. That's the reason the flexors, the front side of the forearm, helps you to flex the wrist, and the extensor, which is the back side of the forearm, helps you to extend your wrist. Okay. Now, primary reasons for tennis elbow. What are the most common reasons people get injury? Okay. So the most common injuries that you get is repetitive movement, okay, which is very common, in some of the occupations like plumbing, carpentry, painting, typing, gardening. Now, many times I get the question that when someone comes with the wrist pain, the elbow pain, they said, I don't play tennis. Well, not necessarily tennis elbow happens if you're playing tennis or not playing. It can happen with the repeated movement. Okay. So let's say somebody is doing painting in their house. Okay, so they're painting wall. They normally don't do it, but for a time they're trying to do it. Yes, it can cause that repeated movement because they're not used to it, and they're gonna get injury on their the extensor group of muscles, and they can get the tennis elbow. If someone is doing typing, that can cause too. If they're already prone, they're not active, they're not doing their exercise regularly, they're very stiff overall, and they're trying to do the typing and everything. So that repeated rotation makes a big difference as well. Okay. Overuse. Okay. So the occupational as I mentioned, the overuse. So repetitive means when you're not overused it, but you just repeatedly did that movement. Overuse it means that that movement is causing some problem, but you still have it's your job. You need to work. You overuse that particular tendon. Okay. Poor technique, very commonly done. Again, the typing is one of them. If you don't have poor technique, so think about your hand is rotated all the time. You're not properly using the mouse or keyboard. That can happen. If you're poor technique in tennis, like when you're playing the tennis, but you don't know the grip, like the grip is the biggest thing. I'm going to talk about the size of the racket in the tennis as well. But if you have a poor technique, if you're not holding the racket properly, if you're not holding the hammer properly, if you're doing some handiwork, if you're not using your wrist like a screwdriver, okay, if you're rotating but you're not your posture is not right, that can happen. Inadequate equipment. So as I mentioned about the grip in the racket. So if you're playing tennis, but the grip is thick, okay? So your handle of the tennis racket is thick or too thin, okay? If your technique, the equipment is not right for you, your hand, that can lead to this problem. Hammer, like if you're using hammer or screwdriver or anything, if you don't have the proper grip, that can lead to the injury. Muscle imbalance. We always talk about mobility, flexibility, strength, and stability because those four things we need in our body. If you don't have that four things, we got a problem. Mobility, let's say your elbow is moving the way it should be, the range of motion in your elbow. I'm not going to go in detail what is the normal numbers and everything, but you should compare with the normal side if you have an issue. Okay, so your wrist, is it moving normally? Okay, I had a fracture last year in my wrist. So if you notice, my the left hand is a little bit more flexible than my right one. So if I go and play tennis or do something, I'm very, very highly chances that I'm gonna injure my elbow. Okay, because my wrist is not more, or the wrist, because my mobility is limited right now. Because I need to work more on that if I can get it. Depend on the injury. Sometimes you can get it, sometimes not. Depend on the injury. Flexibility is your muscles, is your flexors or extensors or your biceps or your triceps. Are they flexible? Are they tight? Because many times people don't have that flexibility, and you got some limitation in your movement, it can cause some injury. Strength. You're not regularly doing exercise, you don't have that much strength in the shoulder or your biceps, triceps, or your forearm muscles, that can lead to the problem as well. And stability. You need your big muscles, your pectoralis. Like if you are talking about playing tennis or you are talking about any daily activities where you repeatedly typing in something, you need to make sure all those muscles are core. Your pectoralis, the big muscles are stabilizing your joint, your deltoid. Those need to stabilize your joint. Age and degeneration. So normally I try to normally I tell all my patients that age is just a number, but you need to make sure that you are keeping up with that because it does like kind of work on your body. So with the age, tendon becomes less flexible, and mainly the ECRB, which is the extensor carpi radialis brevis. Okay, increase the risk of injury. So, and that's the reason most of the time when you look at the sports, there is a retirement age. It's about 30, 35. You know, after that, most of the sports people will get retired because your tendon does get less flexible. So I I have a patient like 89-year-old and 50-year-old and like playing tennis. So it's eight, like you can still play tennis, you can still be active. You just have to pay a little bit extra attention when you already have that kind of degenerative changes going on. So I'm not saying don't play, you're just aging, give up. I never say that. I always want to make sure you enjoy your life, regardless, like you fix the problem, which you can. You can do the prevention. You can, just have to take some precautions. Just do the things that you like it, but take the precautions, take action, and you should be okay. And that's where we come in to help you with that. 555 rules. I came up with this idea that 555 rules are very important for any sports activity, okay, especially with the tennis. So 555 rules is like, like this question I've been asked many times as well. Like, that what kind of stretching do I do before any sports? Basketball, tennis, walking, hiking, anything. So there's list of muscles that you can stretch, So I tell them, okay, 555 rule is 5 minutes overall body stretching and aerobics. Okay. You want to increase your heart rate, So you wanted to do some jumpings and like, some like some activity, some aerobic activity increase your heart rate. You want to stretch bigger muscles. Like you want to make sure your hamstring, your biceps, your like the pectoralis, all those muscles are stretched properly. So you spend about 5 minutes on that. Okay, then you spend 5 minutes on dynamic tennis specific movement, not necessarily tennis specific. Whatever the sports you're playing, you want to make sure that you are working on that specific movement. So, for example, tennis required like backhand, front hand, all those movement that you needed, like the volley, all those specific movement that you needed. You want to practice that. You must have seen like sports people like before they do it, they do just like randomly just do the action that okay without ball they just do that. Okay, the reason is because those muscles that required that particular movement, you wanted to do some like in the repeated movement, so your muscles that required like that you're going to use a lot is ready to take the load. Okay, and then finally you want to do the practice hit. Okay, before you get in the game, before you do any of those aggressive movement, you want to make sure you do some practice hit, so in that way your body, your brain gets in the game, and then the chances of injury gets less. So for any question, anybody, if you have any question, if you have any technical error, like not able to see the screen, let me know. So for good?
Yeah, good.
Okay. All right, the tips for grip. One basic instruction, because I'm not going to go in detail about like techniques and like, how to hold the racket and all. The reason is because most of the time you can see that on the YouTube, or if you have a coach, which is great, you can do that. They should be able to tell you this for sure. But some of the basic things that when you hold the racket, make sure like, you have a one finger, as you see in the picture, there should be one finger gap here. So that's the right size. In that way, it's not too thick or not too thin. Okay. Now, the special test to find out whether you have a tennis elbow or golfer's elbow. This is what we do in our clinic because finding out exactly what you have issue with. Okay. So the first test is called Cousins test, and the second is the Mills test. Okay. So when we do this, and many times if you have seen me in the clinic, I do this, and then we can find out whether you have issue or not. So the first test is a Cousins test. What we do in this is we can hold one hand here, the examiner. So like if you come here, so what I do is I hold one hand around the lateral epicondyle, which is your outer side prominent bone. We put my hand like my thumb around that area just to feel the tendon. And then we bend the elbow 90 degree, then the neutral wrist. And then I ask the patient to go and extend the wrist against my resistance. If the patient feels pain, okay, that sharp pain, that's a positive sign that they have the tennis elbow. Okay, so you want to make sure, like, not, well, it is a high specificity. That means that if someone has it, it will show you that it has it. But sometimes the specificity is low. That means that if sometimes some people don't have it, still it may show you positive. So there is thorough assessment is needed to find out exactly whether you have the issue or not. Okay, and that's the one test. That's a Cousins test. And the second one is a Mills test. What you do is you extend your elbow and you flex the wrist. So examiner, so in this case, let's say if I am examining somebody, I will gonna bend the elbow and then I'm gonna extend the elbow, like extend the elbow and flex the wrist. And this time the wrist is pronated. Okay, that means it's turned face down. And then I'm flexing my wrist and extending my elbow. If so, basically we're stretching. So in this one, we're contracting that particular tendon, which is ECRB, okay, and the other extension group as well. And here we're stretching that one. So we're confirming with the both tests that by contracting, is it causing pain? By stretching, is it causing pain? So we're kind of confirming with both of them. Okay. If those both tests are positive, then I'm pretty sure that you are going through some tennis elbow. Same thing with the golfer's elbow. So what we do to find out is called golf. That's a simple name, golfer's elbow test. Okay, so here what we do is you see like in the first, like this one, you start with the pronation, means like the face down, and then you can rotate and you're flexing the wrist and flexing the elbow. So when you do that, especially when you flex the wrist and when you trigger the pain in inner side of the elbow, that's a positive sign for the golfer's elbow. Now, 11 tips for the self-treatment. If somebody has the golfer's elbow or tennis elbow, this does apply on the golfer's elbow too. Some exercise might be different, but most of the tips kind of goes hand in hand for both of them. So rest, ice compression, everybody knows that whenever you have acute phase, means you just injured and you're having some swelling, pain, you want to make sure you rest it, don't overuse it. You want to put the ice 15 to 20 minutes every 2 to 3 hours. Compression, you want to make sure you wear the sleeves or the brace, that helps, or the taping, that helps a lot. Then you do this gentle stretching. So there are a few exercises that I'm going to share with you later on. I have the whole exercise for the tennis elbow ready. I can send you if someone wants it. Just type in the message and I can send them the email by tomorrow morning with the basic exercise for tennis elbow. Gentle stretching. So very common stretching is like a prayer stretching where you kind of extend your wrist and then you do the reverse prayer. So you're flexing your wrist. You're gonna extend your, like in the bicep, you extend your arm. There are a few the stretching that helps you to maintain the tendon length. Eccentric exercise is the exercise where there are two types of exercise, eccentric and concentric. The concentric means your muscle fibers are coming together. Eccentric means your muscle fibers are expanding, okay? So let's say if someone has a tennis elbow, the eccentric exercise are the best for recovery. So how do you do that? Let's say you have the wrist extensor is the muscle you wanted to strengthen. So you take a dumbbell, not too heavy, without pain, you should be able to do this one. Then you're gonna go in extension, but slowly come down. You can extend your wrist, but slowly come down, okay? So that's eccentric exercise. Then modify your activity. So you need to identify what movement, what activity is causing the pain. And once you identify that, okay, hey, I did the painting, that's why it's causing pain. I'm playing tennis, that's why it's causing pain. I'm doing typing, that's why it's causing pain. So you need to identify those problems and then you need to modify. So if the typing is the issue, I need to see what I'm doing wrong, okay? Not every tips on the Google or YouTube are right for you because your body is unique. You're different. So everybody's different, okay? Ergonomics. So that makes a big difference as well. So you need to make sure your techniques are right. Okay, so if you're particularly playing tennis, you need to make sure your body is moving right. You need to make sure that your backstroke is performing well. If you're playing golf, you need to make sure your swing, you're not compensating. Okay, so you need to observe, and you can have your coach, or you can come here and I can observe. I can do the postural assessment. The consultation is free, so we can just help you out. But that important, like, whatever you're doing, your ergonomics, your posture is like, your setup. Okay, whatever you're working is right. Okay, so your computer desk setup, that's your ergonomics. If you're playing tennis, the court, how you're playing, where you're moving around, like, the whole setup is your ergonomics. The self massage helps a lot. The self massage is the cross friction. So cross friction means your tendon goes down straight. So you use your hand right around the lateral, right below the lateral epicondyle, which is the most prominent bone on the outer side of the elbow. You go a little bit below it. And then once you find that tendon, you need to just go side to side. You hold the tendon and you glide it, you move it. You don't just rub it, you do the friction massage. Kind of go a little bit deeper and you're trying to move it. Okay. The heat application. So many times everybody knows that cold, they start with the cold, but once you become tendinosis, once your injury got chronic, your inflammation is gone. It's less. Like now you're not in acute phase. Then you can use your heat. But if you put the heat in acute phase, you may increase your inflammation because the heat improves your circulation. And you have inflammation, you already have lots of circulation. You don't need more circulation there at that time in acute phase. But once the acute phase is gone, you can put the heat because that will relax the muscles. You can move your joint better. You can stretch better. Then you can help to improve your circulation after the acute phase. Gradually return to activity. So once the pain is a little bit less, once the pain is controlled, then gradually go to the activity. Do not just start with, okay, back to normal. Let's go with all the activities and everything. But you want to make sure, like, that you gradually return to the activity. Okay. Self-care and prevention. So this is also the big one, which people don't understand. Like, better sleep, healthy diet, maintaining your weight, reduce the stress. The stress can affect your whole body, okay, and can affect the quality of your tendon, your muscles, your movement. So believe me, even though it's not directly related to your injury, but indirectly, those kind of things does affect. So you need to make sure, like, you follow. This helps with everything, but it does affect your tennis elbow as well. So especially when you have injury. The treatment options for tennis elbow. So what are the available treatment? There's few more, but these are the very common options that are available. First is physical therapy. So anytime when you get injury, physical therapists can help you to understand like what kind of injuries you have, like why you're getting the injury, what technique you're following, and what we need to do to help you to understand those things and get back to the field or whatever the activity you were doing. Now, how it helps, what physical therapists do. I always tell my patients that we do the things that you cannot do at home. If you the basic, like, you don't need to come here to do the stretch. This you can do at home. So that exercise you can do at home. I can give you exercise, you can do those things. But what we do it differently, what physical therapists do differently. So even though if you're going to any physical therapy center, and if they're just making you do like this, and some basic exercise, then you need to think about it because you want to make sure like you go to the place where you're more hands-on. So how physical therapists can help with the tennis elbow or golf, for example. One, proper strengthening training. You need to find out what muscles to strengthen, how to strengthen, what kind of eccentric exercise you need to do it. Are there any kind of issue with the stabilizers, the other muscles? Because sometimes, even though pain is your elbow, you need to work the whole arm, like your deltoid and everything. So it depends on, like, what's going on with you, we can find out. Manual therapy, it's very important to do the manual therapy because that's the one thing that it is hard for you to do it at home. So when I say manual therapy, cross friction is one of them. Cupping therapy is a different technique, but like gliding, doing the instrumented assisted soft tissue mobilization. There are some manual techniques that we do to help you to heal faster. Okay. Modalities, ultrasound, TENS, especially ultrasound. So ultrasound helps a lot with the tennis elbow. The ultrasound is a sound wave. When you do the ultrasound, the sound wave goes inside deeper in your body, in your tendon. You create the micro vibration, create the heat, and helps you heal faster. Okay. And the taping. The taping is very important because it helps you to move your muscle in the right direction. Because when you have injury, your tendon is not moving normally, not moving smoothly. So when you do the taping, not only it lifts the fascia up and create like good healing process, but it also helps you to move your tendon properly. Shockwave therapy. We got a shockwave therapy here in our clinic, and believe me, it's very, very effective. Some people may take few more sessions than the other, depend on the stage what they are, but this is the very efficient and very quick solution for tennis elbow. And there are lots of research done on this one. FDA has approved this one now for any musculoskeletal conditions. So it really helps with the plantar fasciitis, tennis elbow, golfer's elbow, uh, tendinitis in your knee or like shoulder. It's very effective. Just to give you idea that it works as an acoustic. Okay, so the urologist, they also use the shockwave therapy to break the kidney stone. So you can imagine how powerful is the machine. And now that shockwave we put it right around the tendon, that really helps to break down the scar. So how it helps? So let's say the first thing is stimulating the healing. It enhances the healing. High energy shockwave increase the blood circulation, increase the metabolic activity in the localized area, and then that promoting the new blood vessel growth and the growth factor release. So that helps you to heal faster. So now we're not just waiting for your body to heal gradually. We're just like using this kind of treatment that can really push it. Reduction in the pain and inflammation. So what it does, it reduces the nerve sensitivity, it reduces the pain, and when it does that, and that also triggers that healing process, the growth factor, which helps you to reduce the inflammation and heal faster. Break down scars. As you injured yourself, of course, there will be some scars. Okay, so this mobilizes the scar. It breaks down the scar so your tendon can easily glide, easily move. Also, it's a non-invasive outpatient procedure. It kind of gives you low. I always tell patients when I use the shockwave therapy that it should be comfortably uncomfortable. It should not be too intense. You don't need any local anesthesia. There are two types of shockwave, radical and focus. We have a radical one, which most of the time we use it for tendons and muscles and all. Focus one is very, very intense. Sometimes you need some local anesthesia for that one, which we don't have it. We have the radical one, which really helps with the tendons and the scars and healing process. It enhances the faster recovery. You don't need to wait too long to heal it. You can get back to your activity like faster. Complement to other treatment. Many times, not only shockwave therapy, you kind of go hand in hand in like physical therapy or dry needling. So when you approach 2, 3 direction, you can really see the result faster. Okay, but sometimes, many times actually, not sometimes, many times I've seen shockwave itself helps a lot. All right, steroid injection. That's also one of the options because this is what I see in the healthcare system. When someone has any kind of pain, of course, they're going to see the primary physician, okay, and then they're going to guide what to do and everything. But sometimes, um, not everybody knows what are available treatments out there. So the first thing they do is like suggest the steroid injection, which is fine because it reduces the inflammation. So when you have a chronic issue, and this some of you might have experienced in the past where you have the like inflammation, it reduces the inflammation, but it's temporary. Okay, once the effect of the steroid is gone, and if you haven't worked on it, then pain will come back. Okay, so pain, while the pain is less, strengthen the tendon. It is very vital. It's very important that when the pain is less, you want it to work on it. Okay, because now pain is less, so you want to work on the strength. Because think about it, that collagen fibers that I talked about it, they're still disorganized. It's just the pain is less, but your tendon is not strengthened yet. You want it to work on it because believe me, it's not that easy to just strengthen a tendon in like 1 or 2 days a week. You need to keep on working on it. But some of the common side effect of the steroid, it's a temporary relief, as I said, few weeks to few months. Tendon weakening. If you keep on using, if someone has a chronic issue, they used it repeatedly, steroid, that actually weakens your tendon more. Then it's hard to recover because in the long term, it's not going to help. That's the reason many doctors do not suggest a steroid shot more than twice a year. Flare up reaction. Sometimes instead of the healing, it can flare up, and that flare up the inflammation, and that can even cause more problem. Okay, weaken immune system. That's in a long term, just losing localized may not work like in 1 or 2 times. That's not gonna affect your immune system. But if someone is using the steroid for long term, that can affect the immune system. Dry needling for tennis elbow. So how the dry needling helps? So we did like shockwave, physical therapy, steroid, now the dry needle. What is dry needle? So many of you might know, and some of you might not know, the dry needle is different than the acupuncture. So the acupuncture, even though your pain is on the lateral side of the elbow, they will find certain point in the body. They're trying to bring the chi in the body, and they will put the needle in different places, and that triggers the healing. That's the concept. Here, it's evidence-based. Dry needling is evidence-based, and we go directly on the affected area. So if someone comes with the tennis elbow, I'll put the needle right on the ECRC, like that extensor carpi radialis brevis, okay, and the other tendons. And then we put the stimulation. So it releases the trigger point, because anytime when you injure your elbow, you might develop some trigger point. Trigger point, like when you feel that little bit knot or tender spot, that could be the trigger point. So when you use the needle, it really helps to reduce that hyper irritable muscular trigger points. It really helps you to reduce that. Also, it improves the local blood circulation for sure. Okay, the ultrasound, shockwave, dry needling, all those things does improve your local blood circulation, so it helps to heal faster. It reduces the muscle tightness, because as soon as we insert the needle in the different areas of your tendon, your muscles, it releases the tension in your muscle, so that helps to move your tendon better. Dry needling activate the body's pain modulating process, so it really helps you to reduce the nerve pain, so that nerve ending that you have. So as it said, needling nerve release pain relieving endorphin and the other neurotransmitters. This may lessen the tennis elbow pain. Improves the tissue healing, okay? Muscle activation, because we are not only putting the needle, we are attaching that stimulation, so that helps to triggers the muscles. Now, the taping for the tennis elbow. So I have one video for you guys that I did the taping. So let me see if I can get it. Yeah, I'm gonna get that a little bit later on. Let me finish the slide first. And then I'm gonna show you the taping video. But I'm gonna share the taping for you for sure. Now, conclusion, do not ignore the pain. You gotta make sure, like, if you have an acute pain, take care of it right then before it gets worse. Fix the issue while it's in acute phase. Learn the proper technique to prevent the injury, because once you identify what technique, what movement, what activity is causing pain, you need to modify that. Follow up 5-5-5 warm up, very important. If you're doing the typing, follow up that too. Still, that helps. Try home treatment first, but don't wait too long. So all those tips that I mentioned, try that first. Try maybe a week, and then if it doesn't work, you're still having issue, then yes, definitely we're here. Giveaways for attendee. All these people that who has attended, and I'm gonna make sure I have all the list. Will get the free giveaways will be. Let me stop sharing first. All right, now you can see me. Okay, so we're gonna give this brace. It's a tennis brace, okay, tennis elbow brace. So you can put it right around the elbow, okay? And when you come here, I can show you how you can do it exactly. So all people who attended, they can come to the clinic within the week, and we're gonna give you this one for free, okay? Some people might benefit from the sleeves. We have sleeves as well, but everybody will get the brace for sure. Okay, so this is the giveaways that everybody will get. All right, and I got, let me see. I can share the video for the taping. All right, let me share the screen again. Okay, everybody can see it. Okay, so as you see in the video, there is a 2 tape I needed. Okay, so, all right, first of all, everybody sees that?
Yep, we see
Yes,
it.
sir.
Okay. So you see, you need to make a hole in the tape. So there are 2 strips. One is I and one is Y. Okay. So Y means we just cut it in the center. So that's called, it's called Y shape. That's why it's called Y. And you see kind of a diamond shaped cut I make because I need to put the fingers in this diamond shaped cut. Okay. And then it's pretty long because we need to go all the way to the elbow. So once we cut it, there's no tension in the first one. So the first tape that we put it on, there is no tension, you just lay it. And normally the wrist should be a little bit in the flexion. Okay, so make sure when you put it, okay, so it's a little tricky that you need to make sure it's in, and then make sure the wrist is a little bit more flexion. This one is a little bit less. I usually prefer it's a little bit more flex. Then you're going to go outer side, right on the extensor carpi radialis brevis, which is right around here. Third finger, remember, second and third. So you go right around here and cross the elbow. Okay, and then the second Y strip, this is a Y strip. Okay, so you cut it there and you put the base, the start, okay, right behind the lateral epicondyle. So where you have that bony prominent, you put right behind it. And then you put the tension. In this one, you put the tension. You pull about 75 to 100% tension. You pull the strips. And then you go all across the forearm. And make sure there is no crease, so it's nice and straight. Okay? So that's how you do it. Just remember, when you put this big one, the wrist should be a little bit in flexion, a little bit bent. Okay? So that's how you do the taping. All right. And all right. Yeah, I see Carla, I see Chris. So yep, you're gonna get the brace for sure. And also, we share one more time. We're gonna give away anybody who attended. Typically, we run the deal like in a home, but in the clinic. But we're gonna make sure that if you're doing the shockwave therapy, okay, the first session would be $69, and normal price is 150 per session. And if you buy the package of 5, it's $100. But the first session, whoever attended and they wanted to try it, we're just going to charge $69. And dry needling sessions are typically a little bit higher. We just recently increased the price, but we're going to still keep it $40 if someone wants to do it. And anybody wants to do free consultation, if they're playing tennis, if they have any kind of postural issue or anything like that that they wanted to go over, the ergonomics, I can definitely give you free consultation for 15 to 20 minutes. Okay. So those are the giveaways, and everybody who attended get the brace. So these are the giveaways that you're gonna get. Okay. All right. Any question? Anybody has any question? Okay. So I hope you learned something and something new that can you implement, and you can heal your, if you have any tennis elbow, you can heal yourself. And if you have any trouble, and if you have for a long time, just give us a call. Our phone number, 469-212-8888, or you can text us anytime, no problem. And I will see you all next time. And any question, you can send the text message as well. Once I sign out, and still if you have any questions, just text, no problem. And our email also, it's info@surecurewellness.com. All right, guys, you all have a good night, and we'll see you next time.
Thank you.
All right, thank you, Carla. Bye.
Bye.